The Minister of Health, Adrian Dix, was at Kelowna General Hospital today to celebrate the opening of the new interventional radiology suite at Kelowna General.
Well, first of all, it's a tribute to the community itself, to the foundation which contributed and both raised so much money, but also contributed to this project. So I think it shows what people in Kelowna do when people in Kelowna and the whole region get together and want to do something.
The reason it's nice to have some new equipment is because we can do all these fancy applications. So this is just a case we had before. This is a patient with a kidney cancer. And so, 25 years ago, you get the surgery, you come in, you're in the hospital for several weeks. They come here, it's a day procedure. We use this thing with all the fancy imaging, 3D coordination you can kind of see here. And basically, we're able to just guide a small needle into the tumor, which is right there, push some bowel away, takes like 45 minutes, and then the patient goes home for lunch, right? So that's kind of the difference. It's obviously an expensive thing to have a big angio suite, but minimally invasive procedures, patients aren't stuck in a hospital.
Right.
And so we're doing this for patients from all over IHU. This brings us up to par with the other top sites in Vancouver. So when I did my training at Vancouver General Hospital, we had a similar setup. But when I came to Kelowna, our angio suite that we had been using up until a few months ago was good, but it didn't have all the sort of bells and whistles that allowed us to do some of these fancy procedures. And this new machine, this new top-of-the-line model allows, it's safer for patients. We do this stuff quicker. There's less radiation. And some of these other features that I've alluded to allow us to do things that we just couldn't do before.
This IR suite, though, shows our continued efforts at this hospital to give the highest possible level of care. We're building out the MRI capacity of the hospital. In BC, we've dramatically increased the number of MRIs we're doing and funding. We've gone from 170,000 to 305,000 in the time I've been Minister of Health, an increase of 240,000. Imagine this in each case, CT scans in the province, an increase of 135,000 in MRIs. Essentially, as we grow out the equipment, here we're bringing MRIs to this hospital. And when you say, what does that make a difference? Well, it makes a difference in terms of wait times. We've gone from the bottom of the country to the top of the country. Still a lot of challenges, right? But also the quality of care people can get. And it means lower length of stay. Because if you've got to wait 2 days while sitting in your hospital bed for an MRI to be diagnosed, that's 2 days you've spent in a hospital bed that someone else isn't in, and you're essentially just waiting for care. And so all of these things make a big difference. It's why the foundation, the community, the regional hospital district, everyone is so involved in these kind of projects, because they make healthcare better and they make all the other problems easier to cope with.